Hello, I'm Jeremy Fernandez. Welcome to The Virus, your look at the key turning points of the week in the race to beat COVID-19 and where we're headed on infection rates and the tough social distancing restrictions. Despite some sizeable new outbreaks this week, the slowdown in the number of daily infections overall is sparking some hope. We've had fewer than 50 cases each day in the last 5 days. However, there have been some sobering developments as well. A crew member from the Artania cruise ship, a man in his 40s, has died, becoming the country's youngest victim. When you bring different countries' progress onto the same timeline, this is what it looks like. This world curve plots the total number of infections that each country has had from the day it reached 100 confirmed infections. Now, some countries are consolidating their gains by flattening the curve with drastic public health measures, and others are continuing to climb. You can also make out the second wave of new cases in countries such as Japan and China. Now, that breakout is what policymakers want to avoid as much as possible. With fewer infections and the growing unease about isolation, the government here has outlined a roadmap to easing restrictions, and it could happen as soon as next month. But 3 strict criteria must be met before the rules are relaxed. Michael Slezak explains.
How does a nation in the grip of an emergency shutdown find a way out?
What we need to do is keep the restrictions in place and then slowly lift them.
To get people back on the streets, the Prime Minister says we need to do 3 things. The first is more testing. So far, we've just been testing people with symptoms of COVID-19 or other high-risk groups like return travellers. But now we need to try to test everybody. It's called sentinel testing, testing different people in different ways. One very different way is to examine what's going down the toilet.
To spot an early outbreak that might occur that we might miss through other forms of testing. Also, the degree of viral load we might find in the faeces could give an idea of how severe the outbreak is.
The second part of the exit strategy is contact tracing. Once a person tests positive for COVID-19, massive nationwide teams track down everybody that person has interacted with. Small teams used to track cases of measles or HIV have been dramatically expanded. The government's also developing an app that will help authorities find anyone who's been in contact with confirmed cases. Today, refusing to rule out forcing everyone to share their location data.
I've always been a believer in the Australian people making the right decision, and so I think a voluntary approach at first is definitely the way to go.
Even with all those measures in place, outbreaks are still possible, and then the response becomes important. Australia is now in a much better position to contain an outbreak than it was when COVID-19 first arrived. We could see further use of the Defence Force, which was called in to help address an outbreak in Tasmania this week. Whatever the case, experts say patience will be required.
What this is really about is finding a way to fine-tune the degree of lockdowns, not in terms of finding our way out of this COVID-19 situation, which is going to go on for a while.
Michael Slezak, ABC News.
Well, it's not only the national restrictions which may end in the next few weeks. International travel is also being discussed, beginning with New Zealand. Its Deputy Prime Minister Winston Peters says New Zealand and Australia are considering when to ease border controls, effectively treating New Zealand as a 7th Australian state.
It's almost like we've got a trans-Tasman bubble between our 2 countries. And if the figures keep on going that way, that is a serious possibility. Yes, we're exploring that as we speak.
Meanwhile, the US has also outlined a 3-stage plan for states to partially reopen. President Donald Trump says the improvement in some areas has been so positive they could start getting back to normal in as little as 6 weeks. But first, the authorities there want to see a 2-week decline in COVID-like cases and the introduction of a robust testing regime. The situation in the US is far more grim, of course, than it is here. They have more than 670,000 cases with more than 34,000 deaths. And the number of people filing for unemployment benefits in the past month has reached 22 million. Mr. Trump has told state governors it'll be up to them to decide how to reopen each of their states again.
As I have said for some time now, a national shutdown is not a sustainable long-term solution. To preserve the health of our citizens, we must also preserve the health and functioning of our economy. Over the long haul, you can't do one without the other. Cannot be done.
Well, President Trump's announcement follows widespread condemnation of his decision to cut funding to the World Health Organization in the middle of this crisis. Mr. Trump has repeatedly criticised the UN body's handling of the pandemic, accusing it of mismanagement and covering up data on the spread of the virus. He also says the WHO is unduly influenced by China, which the American government says covered up the origins and caseloads of coronavirus. If these cuts are enacted, the funding cuts would force the WHO into bankruptcy.
When we're divided, the virus exploits the cracks between us.
What was the point in Tedros to say, yes, you're cooperating now, but we heard you concealed before, so shame on you, shame on you. What would we have gained? I think nothing. We would have actually forced China to posture and maybe to be less cooperative.
So as far as the WHO is concerned, who does pay? North America correspondent James Glenday takes a look.
America is the WHO's biggest single funder. According to the organisation's figures for last year, the US provided just under 15% of its total budget. The next biggest contributor is the Bill and Melinda Gates Foundation, followed by the UK and Germany, while Australia chips in almost $30 million. Just under 70% of the money is spent in Africa and the Middle East. More than a quarter goes to eradicating polio, 2% on HIV and hepatitis. Preparedness for pandemics accounts for just 0.8%.
The WHO failed in this basic duty and must be held accountable.
Donald Trump has looked increasingly under pressure and has tried to partially blame the media, Democrats and state governors for some of the enormous economic damage and loss of human life this pandemic is causing.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
Well, this week has brought us another reminder of why this virus is so troubling. There are now more than 2 million cases of infection and more than 145,000 deaths attributed to coronavirus. China has now increased its death toll significantly, adding 1,300 deaths from the city of Wuhan. The revision follows widespread speculation that the country's death toll had been significantly higher than reported. Now, the best way for countries to tailor their responses is to remove the unknowns in their modelling. And experts say to do that, testing needs to be available to more people. Here, federal and state authorities are now broadening the process. New South Wales is the latest state to allow anyone with flu-like symptoms to seek a test. Groups such as healthcare workers and people living in outbreak hotspots will also be offered the test. That's because of fear that many people may have the virus already but not know it because they feel well. Well, the ABC has now received more than 50,000 questions from you, our viewers, about the coronavirus pandemic. They've ranged from day-to-day do's and don'ts to the complexities of the virus's biology. This week we brought in the epidemiologist, Associate Professor Hassan Vali, and national medical reporter Sophie Scott to answer some of those questions. This question is from Rebecca. Can my family travel and congregate in the same house or office to address a family death or probate or legal issues around her father's estate? Police haven't been able to offer any guarantees about how lawful that would be, so she asks, where can I go for advice? Sophie?
Well, look, I think the answer is that it would probably depend on the state and territory. Some state and territories have been very, very cautious and actually pulling people over in the car to say, where are you going? And, why are you out travelling? It would be safer for all involved if they could do it as a virtual conference and just get onto a video streaming service and do it as like a FaceTime or a Zoom or some other way like that. That way, that's going to minimise the risk.
Dr. Valley, can I get your take on that?
Yeah, look, firstly, I was glad you asked Sophie first because that was a very difficult question. I think we're being asked to do very challenging things at this time. And, this is one of those situations where, as Sophie pointed out, there are risks associated with coming together. And I know in Victoria, the messaging is very clear. There are only 4 reasons why you should be leaving the house. So it's very tough, but the consequences of something going wrong in that situation could be quite significant. And then there's the broader question of, if you allow that to happen, where do you draw the line?
JL, who's reached us on Facebook, asks, what is the actual research, scientific, not economic, guiding the decisions on going back to school? Janine Healy-Meldrum points to a number of coronavirus infections in children and teenagers, and it makes her wonder about how safe it is to go to school and whether children are spreaders. Dr. Valley.
This is probably the toughest question, I think, to answer. And so I'll say a few things. Firstly, it makes a kind of intuitive sense to people for children not to be going to schools. It just feels right, given all of the other sacrifices that we've had to make. But the question that's been asked is a really good one. If you can step back from that gut feel that you have that, we shouldn't be going to schools because that brings people together, what does the evidence actually say? And it's really interesting because the evidence probably comes from three sources. There's evidence that we've obtained from previous influenza pandemics and epidemics. There's evidence from SARS and MERS and modelling that's been done around that. And then, of course, there's evidence from what has actually happened, over the last 3 or 4 months around the world. And the really interesting thing is, when you look at the evidence, the actual evidence, now there's obviously a little bit of contention there and it's a bit messy, but a lot of it pretty much says that there is only a marginal benefit that you get from closing schools, but that comes at a massive cost. So it comes at a massive economic cost, a massive social disruption cost, maybe a cost to the health system with essential workers not being able to go into work. And of course, there's the educational cost. So you can see why this is such a difficult policy parameter for governments to deal with, because on the one hand, there's a gut feel that we should be closing schools just to eliminate as much risk as possible, but the evidence is pretty marginal.
Dr. Valley, is it risky for our immune systems in the long term, for our bodies, not to be attacked by the various random viruses and germs we would normally be exposed to in day-to-day life? Now that we're using loads of hand sanitizer and washing our hands well and not touching our faces, does this make our bodies get a bit lazy when it comes to fighting off disease?
Yeah, look, an interesting question. I think we've got to separate out the fact that we're in a particularly unique situation right now that's not going to be the case forever. And so we have to adopt a whole range of measures that may not be the case, hopefully, past the end of the year. Hopefully, before too long, we'll start to ease some of these restrictions and we'll start to revert back to doing things the way we normally do. So I think we've got to make sure we keep that separate from what we might do long term. And the evidence is really interesting about the effect of having sort of day-to-day infections on priming the immune system. And, this is where this whole field of healthy bacteria has taken off in the last few years. So, yeah, I think, the shorter answer is that we've got to be careful that we don't go overboard and that we recognise that there are good bacteria as well as bad pathogens.
Dr. Valley, this question comes from John Ashworth and Ricardo Anuvio from Facebook. How are people who've had the virus faring? Do they fully recover or are there lasting effects?
Yeah, it's another good question. And I think, once again, we don't have a whole lot of data, but obviously most people who recover seem to recover fully. And that's similar to what we saw for SARS. So people who recovered from SARS seem to recover fully, and there are very few people that had long-lasting effects. So perhaps that's another bit of good news for people that do recover.
Now, there are many more questions and answers, including what the reopening of school might look like in the coming term. You can check out our full 40-minute chat on the ABC News YouTube and Facebook channels. We'll be live streaming those question and answer sessions every Friday at 3:15 Eastern Time. Thanks for your company. Bye for now.